Much for joining us. We continue with the news. Ministry of Health Permanent Secretary Lakson Kasonka says there is a critical shortage of medicines and medical supplies in health facilities. He says despite this, there is little that can be done to immediately restock the medicines and medical supplies due to the long processes of government. He says despite his desire to have health centers restocked, red tape is hindering his actions.
Approximately 1.6 million Africans died of malaria, tuberculosis, and HIV-related illnesses in 2015. According to the World Health Organization, these diseases could have been prevented or treated with timely access to appropriate and affordable medicines, vaccines, and other health services. However, less than 2% of drugs consumed in Africa are produced on the continent. The locally made ones, mostly painkillers such as Panadol, are given to patients as a general treat or sickness drug. Despite initially denying this fact, Ministry of Health Permanent Secretary for Technical Services, Lakson Kasonka, has finally admitted that health facilities in Zambia are in dire need of all medicines and medical supplies. He says the current little stock is quickly running out.
I'll not sit in my office and say, oh yes, everything's there in the hospital. No. Again, it's not because we have no capacity. It's because, you see, as government, it's not what I want by myself. It's about what is right. What are the right procedures to follow? Even if I've got so much power as PS to get medicine in the country, I have to follow the steps that are laid down. There are other regulatory authorities that influence my decisions so that we work together as a network that is premised on correct procedures.
He blames this situation on red tape in government procedures.
That's how government works. Whether that is unfortunate or not, but this is not a private entity. Government is the biggest company you can think about, and there has to be consensus in everything that we do. There's a lot of things I like to do in my office. I like just now and yesterday medicine in the hospital, but I have to follow a lot of guidelines and it concerns me much more than probably anybody else, because that's my job, is to ensure that the drugs in the hospital, and where there are not enough drugs in the hospital, it's me. I keep phone calls. No, we couldn't do this and that because we don't have this and that. This is what I'm trying to get over.
Now, many Zambians continue to experience the sad situation of being forced to spend money on their own consumables and drugs whenever they seek healthcare services. But for Professor Kasonka, he too blames it on government procedures. Virginia Chilongo, MUVI TV News, Lusaka.
Called on different stakeholders in the country to help the vulnerable children, stating government